Do you sometimes feel like your chest is tight? You're whistling and breathing becomes difficult. Many people ignore these signs, but sometimes it could be asthma. Let's talk about asthma and the warning signs you should never ignore, because asthma is a dangerous illness. In fact, whatever has to do with your breath can never be negotiated, because oxygen is not a choice, it's a necessity in our body. Every sensitive part of our body, the brain, the heart, the lungs, the liver, and every other organ in the body, as much as the cells, as little as they are, the organs, the systems, they need oxygen to function. In fact, every little part of your body needs oxygen to function. And when there's no oxygen, there is a problem. First, let me ask you, what do you understand about asthma? I believe you must have been hearing about asthma for a very long time now. And a lot of persons may have had these conditions, and you may have seen or met or have anybody in your family that have had this condition before. So let's talk about asthma. What do you understand about asthma? Now, asthma is a condition where the airways in your lungs becomes inflamed and narrowed.
Asthma, not just shortness of breath, but narrowed airways under pressure. The lungs are built for flow. Air moves in, air moves out, smoothly. In asthma, the airways become reactive. Triggers vary: allergens, cold air, exercise, infection, stress. When exposed, the airway lining becomes inflamed. Muscles surrounding the bronchi tighten suddenly. Mucus production increases. The passage narrows. Air can enter, but struggles to leave. Wheezing begins. Chest tightens. Breathing becomes work. This is not weakness. It is hypersensitivity. The immune system overreacts to stimuli that are not inherently dangerous. Inflammation lingers even between attacks, keeping airways more sensitive than normal. At first, episodes may be rare. Over time, without control, reactivity increases. But asthma is manageable. Inhaled medications reduce inflammation. Bronchodilators relax airway muscles. Triggers can be identified and minimized. Lung function can stabilize. Asthma does not mean the lungs are damaged beyond repair. It means the airways require regulation, a reminder that breathing is not just mechanical. It is immune, neurological, and environmental. And that airflow depends not only on lung capacity, but on how calm the airways remain when challenged.
What I mean by the airways are the passages, those tiny, tiny spaces in the lungs where the oxygen passes, where the air passes. When they become inflamed and become narrowed, they constrict and they close. When this happens, it becomes difficult for air to move in and out of the lungs. This is why people with asthma may suddenly struggle to breathe. Now let's talk about the common signs. Number one is frequent shortness of breath. You may feel like you cannot get enough air, especially during exercise or at night. And number two, wheezing sound when breathing. This is a whistling sound from the chest. Sometimes you can even hear it out. And sometimes someone who is standing very close to you can hear it and wonder why your heart or your chest is whistling like that. Number three, chest tightness. Most people complain about this. Some people feel pressure in the chest, like something is squeezing it. And number four, persistent cough. That cough that stays and does not want to go. And you hear the person keeps coughing off over and over and over, and it extends over 1 week, 2 weeks, 3 weeks, but not tuberculosis. Especially at night, may be signs of asthma. Now, very importantly, what can trigger asthma? A lot of persons have confusion about this. Several things can trigger asthma symptoms, such as dust and smoke, cold, exercise, strong perfume or chemicals that you inhale, respiratory infections like common cold. When these triggers irritate the airways, the breathing tubes become swollen and produce more mucus. That is that catarrh that is sometimes cough out. Now, when does asthma become dangerous? Asthma can become life-threatening when not properly treated. Warning signs of a severe attack includes severe difficulty breathing, lips or fingers turning blue, inability to speak properly. If this happens, immediate medical attention is urgently needed. How can asthma be managed? Of course, you want to know how asthma can be treated. Although asthma has no permanent cure. You're hearing this for the first time, right? Yes. Asthma has no permanent cure, but it can be managed and it can be controlled. Doctors usually prescribe medications like inhaler that helps open the airways and reduce inflammation. Avoiding triggers and following medical advice is very essential, and this can help people live active and normal life. Asthma is a common condition, but many people ignore the warning signs. That is when it gets complicated and can become life-threatening. Now, if you notice frequent breathing difficulties, wheezing or persistent cough, it is very important to seek medical advice. Taking asthma seriously can help prevent a whole lot of things. It can prevent dangerous attacks and protect your lungs and help you live healthy, long, fresh, strong, normal, and active. Asthma is a common disorder, a common illness, and it's not juju. So please, don't relate it to juju. No be juju. It's a common illness that can be treated and managed. If you find this video interesting and impactful, don't forget to like, share, and subscribe. See you in my next video.